Ted Dumbauld is a veteran who runs a medical marijuana dispensary in Connecticut. He sees firsthand the dramatic results that cannabis can bring to veterans suffering from post-traumatic stress disorder, PTSD. But he also sees their pain as they fight to get it.
Medical marijuana is not a panacea, but for many people it has been demonstrated to work extremely well.
Connecticut is one of the few states where PTSD is an approved use of cannabis, unlike in New York and here in New Jersey. But that doesn't mean much. The Veteran Affairs Department still does not allow VA doctors to utter a word about the medication. That leaves veterans facing high costs and stigma for the one medication that appears to work.
I was worried about my benefits being cut off, and I just didn't know what would happen.
Paul is a 35-year-old veteran living in Connecticut. He fears the stigma that could come with medical marijuana usage and wishes to remain anonymous as he talks about his experience.
I addressed that issue with the doctor. Yet again, I was treated like a drug addict. According to them, they don't believe there's enough substantial evidence to prove that cannabis assists with post-traumatic stress disorder.
He served as a Marine during the early 2000s in Iraq and Kuwait. He returned 11 years ago, but to this day he still suffers from nightmares and severe anxiety. He's now one of thousands in the state paying out of pocket for medical marijuana to reduce those symptoms, despite being guaranteed health care by the Veteran Affairs Department. Now keep in mind, an estimated 500,000 veterans of the 2.5 million across the country suffer from PTSD, with an average of 22 veterans a day committing suicide. Now Paul and other veterans say medical marijuana could change that statistic, but the VA would have to sign off on it to make that happen.
The infuriating thing is that these politicians have these conversations about how much they care about our veterans, and the majority of them have no idea of what the experience of PTSD is, and then they don't do what they can to help them and provide them with a drug that can actually make the experience
better.
It's
a no-brainer. We have two men in power who can make a difference. You've got Governor Christie, you've got Governor Cuomo in New York. These two men have never served in the military. We're talking about people who have actually risked their lives abroad to defend us. Have their back.
Yeah.
Let them have what they need.
Thanks, Nana.